Someone asked me, they said, how long did it take you running to not hate it? And I said, well, I still hate it. I just hate AFib more.
Welcome to Healthy Living, Wellness and Prevention, Medical Innovation, the Informed Side of Care. Welcome to Baptist Health Talk.
Hi, I'm your host, Sandra Peebles. Welcome back to a new episode of Baptist Health Talk, where we answer your most searched questions on trending topics. Today, we're talking about atrial fibrillation, also known as AFib, and we're joined by Dr. Bryan Wilner, electrophysiologist at Baptist Health Miami Cardiac and Vascular Institute. And we also have Mark Watson, a firefighter and cardiovascular patient who has AFib. And thank you both so much for being here, telling us your story, and clearing up so many questions that we have.
Of course. Thank you.
So let's dive right in. Dr. Wilner, can you break down for us what is AFib and how is it diagnosed?
Sure. So atrial fibrillation is an irregular heart rhythm. The way that electricity normally conducts in the heart, you have a beat in the top chamber and then a beat in the bottom chamber. Beat in the top chamber, beat in the bottom chamber. When you have atrial fibrillation, the top chamber is not getting a nice contraction. It's fibrillating. Boom, 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 boom. So it's irregular, and that causes the bottom chamber to beat irregular, and that is what atrial fibrillation is. The way atrial fibrillation is diagnosed is with an EKG.
And so what happens is that the blood isn't getting to where it needs to go. It's not pumping
Yeah,
down.
so the blood gets pumped out irregularly, and that can increase the risk of stroke, which is one of the main reasons and most important reasons why if someone has atrial fibrillation, it's so important to be diagnosed and to be treated appropriately.
And how is that different from a heart attack?
So when you have a heart attack, traditionally what that is you have a blockage in one of the arteries that decrease oxygen to the heart. When you have atrial fibrillation, this is due to an electrical problem where, again, the heart beats irregularly.
And Mark, you experienced several AFib episodes over a short span of time. What were you feeling? What were your symptoms? And why do you think that you were able to intervene and jump right in and look for help?
Well, I did have a couple episodes, but I didn't realize the initial episodes were actually AFib. I had some dizziness, some lightheadedness, but it was always when I was outside in the sun, doing exercise, exerting myself. So I just attribute, I'm lightheaded, I'm overheated, dehydrated. So
what did it feel like?
Just some dizziness, like if I was sitting down and I stood up real quick, I'd get a little bit lightheaded, but it would pass and I would continue my day normally. It wasn't until I had an episode that woke me up in the middle of the night. I know my resting heart rate, and I know my heart rate when I woke up in the middle of the night was in the low 100s. So I'm like, I'm sleeping. Like, this is not normal. Being a firefighter paramedic, I took my pulse, and like the layman's way I determine AFib is that it's irregular. So I didn't have an EKG at home, but I was like, okay, this is a problem. But it was literally the middle of the night. So I was like, I'm not going to die, but I do need to see a doctor about it. So in the morning, I drove myself to South Miami Hospital where they did an EKG. And by this time, my rate had come down, but I was still in the irregular rhythm.
And you say irregularly?
I don't know if the doctor would agree with me.
Well, I think,
on the street, that, irregular.
I think it's a medical term for definitely,
Yeah.
but obviously you're a firefighter. You have some kind of knowledge. Do you think being a firefighter helped you realize that something was happening, that you needed to look for help?
Well, yeah, because even in my instance, then looking back, I was like, those were probably the initial AFib episodes I was having, when I was experiencing what I was attributing to, you're overheated, you're exhausted, you're dehydrated. But obviously when I couldn't use those good excuses that we all use sometimes.
Sure.
I knew, okay. And it does, I knew, like I said, I knew I wasn't dying, but that definitely needed to be treated. And early treatment is, like so many things, what determines the success of the outcome.
But it's so easy to let it go, especially because we could think that it's stress or that it could be anything else.
Correct. Yeah.
So Dr. Wilner, are there other symptoms other than these symptoms that really seem very easy to confuse with something else? Are there other symptoms that might really let us know what's
Yeah, of course.
on?
So, what Mark experienced is very typical of patients we see with atrial fibrillation. So the most common symptoms that someone has are palpitations, or they'll feel fluttering of their chest where, their heartbeat it feels off to them. That is the most common symptom. But there's also some more subtle symptoms from atrial fibrillation. Some people might feel more fatigued, short of breath, less energy. So there are a lot of non-specific symptoms that may be due to atrial fibrillation. And, at times there's even people that have no symptoms at all from atrial fibrillation. So that's why it's so important. If you have any of these symptoms, you need to be evaluated by a physician.
And those that are asymptomatic are also in danger? Is it just as dangerous or does this increase once those symptoms start to present?
Yeah, that's a really good question. So even patients that are asymptomatic, if they have atrial fibrillation, they could potentially be at increased risk of stroke. So that's why, surveillance is very important. I'm sure we'll get to this later on in the talk, but there's new ways to evaluate for atrial fibrillation. Patient consumable devices such as Apple Watches and some other devices as well are other tools that we now have to help diagnose atrial fibrillation.
That's so interesting how technology, just these simple devices that we all wear really could help save our lives. What an incredible impact. Mark, once you were diagnosed, what did the doctors tell you? Are there things you should avoid? Are there things you should do?
Yeah. So upon my initial diagnosis, the doctor gave me the lose weight, exercise more, drink less, that we all hear.
Sure.
And and I wasn't really I was the normal social drinker. I was a little bit overweight, but with my job, I stayed active. I had routine physicals. But it's an eye opener. So I lost, like 35 pounds.
Wow.
This kind of started during the beginning of COVID when we were all a little bit hunkered down. So, the alcohol consumption was probably a little more than normal, but I cut that back, to very rarely drinking, if any at all. Lost the weight, started jogging, and but the episodes weren't frequent, but they didn't completely go away. So the initial treatment was what they call pill in the pocket. They prescribed me some medication, and if I was to have an episode, just take the medication, and if it went away, all is good. And so I did that for a while, and then it became the medication didn't work as well. So my choice was to up the dosage of the medication because I started off on a very low dose, or move forward with an ablation.
That episode that you had that you described where you really realized something was wrong, how long ago was that? Like, how long have you been in this process?
Oh, that was probably a couple years ago. Like my initial episode in the middle of the night that sent me to South Miami was a couple years ago.
Okay. So you've been dealing with this for about 2 years.
Yeah.
And all those physicals that you would take at work, they never discovered this.
No.
It's not something
No.
What is the number one risk factor, Dr. Wilner?
So there are several risk factors for atrial fibrillation. In terms of, there's not so much a number one risk factor, but the most common risk factors are age. So anyone over the age of 65 has an increased risk of atrial fibrillation. Other risk factors include hypertension, diabetes, prior heart attack, having heart failure, prior stroke. These are the main risk factors for atrial fibrillation.
Is it hereditary?
That's a really good question. So there is a genetic aspect, and I think even Mark had said that both his parents have atrial fibrillation, and he has it as well. So it's not truly only hereditary. So just because you have a parent that has atrial fibrillation does not mean that you're going to have atrial fibrillation. But clearly there's a genetic component as well as environment component as well.
And what can people do? Is there some action that we can take? And I know that we talk about the diet, of course, and exercise.
Yeah. So again, controlling risk factors is very important, not only to prevent atrial fibrillation, but to better control it if you have atrial fibrillation. So what does that mean? Control risk factors. So control the high blood pressure, control the diabetes, exercise, 30 minutes of aerobic exercise a day, decrease your alcohol consumption, less than 1 drink per day. A lot of questions I get from patients are, what about caffeine, coffee? Can that trigger atrial fibrillation? There actually was a study done that shows that caffeine in moderate consumption does not increase your risk of atrial fibrillation.
Moderate is?
Moderate, right.
Two cup, wait, no, we have to kind of give people an idea. Is it about 2 cups of coffee a day? Is that moderate?
Sure. So I think 1 to 2 is fine.
Okay.
Clearly, if you're someone that you say, hey, doctor, every time I have coffee, that triggers my AFib, then yeah, you shouldn't be drinking coffee or energy drinks. But as a general statement, having 1 to 2 cups of coffee should be fine with atrial fibrillation.
What other triggers? What else? Stress? Could stress set
Absolutely.
it off?
Stress can trigger it. Screening for sleep apnea is important as well.
So Mark, you ended up having a procedure and getting your AFib under control. Tell us about that procedure. What was it?
So yeah, I had the ablation done where they did what they call pulmonary vein isolation with Dr. Pasquale. And they, I had my initial consultation with him as an electrophysiologist when I was first diagnosed with AFib, along with my the cardiologist. And, when they decided, okay, I don't need, we can hold off on the AFib initially. And then when the medicine wasn't, Dr. Pasquale's and my cardiologist said, let's move forward with the ablation. So we scheduled it, and it was pretty quick from the time we decided to do it. They were very good at giving me all my options, explaining everything, and telling me, we know it's a big decision and take your time. But by the time when I did, consult, with my family and looked at everything, and it was within a couple weeks I was having the ablation done, and it's been good.
Interesting. A big decision. Dr. Wilner, explain to us, why is it a big decision? What is an ablation? What is the procedure like?
Yeah, absolutely. So what Mark is describing is really a very classic trajectory of how atrial fibrillation presents in someone. So he had an initial episode a few years ago, and over time, he started to have more of those episodes that lasted longer. And that is really how atrial fibrillation presents itself in patients. You initially have one episode, it goes away, and then over time, the episodes happen more often and more frequent. In terms of, again, the main reason why atrial fibrillation is so important to diagnose is it increases the risk of stroke, and we have medicines to prevent the risk of stroke if you have atrial fibrillation and are at increased risk. But also, many people don't feel well when they're in atrial fibrillation. And we know over time that because atrial fibrillation is progressive, patients can feel more palpitations. It becomes harder to control the more advanced the disease is. So then that comes to, how do we treat the actual atrial fibrillation with what's called rhythm control, where we're trying to get patients out of atrial fibrillation and stay in sinus rhythm. The two ways that can be done are with medicines or a procedure called an ablation, which I'll get to now. And we have multiple studies that show long-term ablation is more effective than medicine. And it's the reason why ablation is performed so commonly now in patients with atrial fibrillation, because the outcomes are excellent in decreasing the burden and potentially freedom of atrial fibrillation. In terms of what is an atrial fibrillation ablation, it's important to know that it's an outpatient procedure. So you come in the morning, you have the procedure done, you leave later that day, you're back to living your life 1 or 2 days later. Atrial fibrillation comes from very specific areas in the top chamber of the left side of the heart called the left atrium, specifically in areas called pulmonary veins. So what we do with an atrial fibrillation ablation is we put catheters up into the heart and we quote unquote ablate the areas where the pulmonary veins are. And essentially what we're doing is we're preventing electricity or triggers that start atrial fibrillation from leaving the pulmonary veins.
And so is there a side effect? In other words, do we need to have that electricity there? And if it's not there, then what's the effect?
Yeah, that's a really good question. So our normal electricity does not come from the pulmonary veins. So the answer is no. So again, the goal of an atrial fibrillation ablation is to do what's called a pulmonary vein isolation, where we're basically zapping the area of electricity in the pulmonary veins. And again, we know that early ablation improves outcomes. If you're able to ablate early on in the disease course, your outcome is much better compared to if you wait for many years after being diagnosed with atrial fibrillation and have the ablation much later on. When I say early, typically what that means is within 1 year of diagnosis.
So you fall into the category that that you really took action quickly, thank goodness, that you didn't just ignore these symptoms like so many people could potentially do. How do you feel today? And are you on any type of medication? Are you on maintenance? Are you free and clear? Tell us, where are you at today?
So today, as far as medication for my AFib, I'm free and clear. I was on some blood thinners for a while afterwards as precautionary, a little bit before the procedure and then a couple months after. But then when I had my 3-month follow-up and everything was good, I came off those. So I'm not on any antiarrhythmic medication or any blood thinners. I take an aspirin just as precautionary, 1 baby aspirin a day.
And that's it.
And that's it.
And you're able to exercise? You could do your cardio?
I'm back to my full exercise regimen. I jog 3 times a week. I do a rowing machine. I try to stay active, every time I want to order pizza, I'm like, I already had it this week,
Good.
So
that's probably a good behavior for you in general, right? It's probably helping your liver as well. So that's okay.
I told someone asked me, they said, how long did it take you running to not hate it? And I said, well, I still hate it. I just hate AFib more, you know?
Interesting.
And knowing that, my weight and my blood pressure is a risk factor and stuff. So
Dr. Wilner is telling us that this is an outpatient procedure. It's just a couple of days. How was that recovery for you?
It wasn't bad. I was the first of the day, so I got there very early. I think it was like 5 a.m. They wheeled me into the procedure room at 7:30, and I was going home that evening between 5 and 6. And it was pretty normal at home, a little bit sore, a little bit of bruising from where they went in.
And how is that? Do you have scars?
No, because they go in through your leg and your groin there. And so no scars. They, for us men, they do shave you. So that was a little bit awkward for a while. But then, a little bruising, a little soreness. But the next day, I was not my normal, I wasn't back to work because I work as a fireman. So that I had to wait, but if you worked in an office or something, you could definitely go back to work.
That for someone that's not, a doctor, it's mind blowing, really, that a surgery could, of that nature that obviously is in your heart could be, that simple, if you will. And I don't mean to lessen, obviously, your craft and your beautiful science. But it does seem like, well, if you could go home the same day, it's amazing. People in their 40s, like Mark, are being diagnosed more and more with AFib. So why are we seeing this? Is it our lifestyle? Why is this happening?
Yeah, that's a really good question. So I think atrial fibrillation is being diagnosed more commonly now. I think we as physicians and the medical community has done a very good job recently in AFib awareness. And I think also now that many people have these patient consumable devices such as Apple Watches, and there's a few others on the market as well where people are wearing them, and it is diagnosing atrial fibrillation. I see several patients in clinic weekly that, their device says it's atrial fibrillation. Now, that doesn't mean that it always is atrial fibrillation, but, just that we have another way of potentially diagnosing it, I think people are becoming more aware of it.
Yeah, I'm always checking, my stats, and people ask me, well, what does it matter? Well, it does, because I can see my patterns when I sleep, how I'm breathing, what's my heart rhythm while I think it's incredibly important and powerful tool for me that I'm so aware of my health. And I think that's a big message for us here, because when you're aware of your health and you're taking control of your health, you can realize these things. I think other people might If they're not paying attention. One question that I have for you is, why is it that there is a higher risk of stroke for people that have AFib? What's the relation?
Yeah. So the reason why patients have higher risk of stroke when you have atrial fibrillation is, again, the top chamber of the heart when you're in atrial fibrillation is not getting a nice contraction. It's fibrillating. And when that happens, the blood isn't getting pumped out of the heart in an in-sync way. And that can lead to clots forming in the heart. And when a clot forms in the heart, if it gets pumped out of the heart to the brain, that's how a stroke forms in atrial fibrillation. So again, if you have atrial fibrillation, you are at a higher risk of stroke, but whether you need to be on a blood thinner or not is a conversation that you need to have with your physician.
And Mark, you're a hero for the work that you do. And you're a hero for being here, of course, because you're obviously creating awareness and sharing your very personal story. So thank you for that. Mm-hmm. What message do you have for people? What would you want people to know about AFib?
That it's out there. I think what the doctor said is right. And that's what they told, when we talked about I'm relatively young, relatively healthy, it's
very young.
I mean, I know I see people with AFib and they're usually much older, but he's
Can I ask you how old you are?
49, I'll be 50 in 2 months.
We didn't mention your age. Yeah. And I just want to say it because of the fact that you're in your 40s,
yeah.
Obviously very young.
And I actually know some other people in my same age group, that have been diagnosed with AFib and stuff. So it is more common now, but I think a lot of it is, like you said, the awareness is a lot better. Cause that's, I brought it up to Dr. Pasquale and he said, no, you just, know about it earlier. Your dad, who knows when he initially developed AFib, but so yeah, awareness, and then to do something about, don't just shrug it off to, I don't feel good, I'll take a nap, I need water, we all do those little things. And I guess, it's okay to a point, but when that doesn't,
I think that when it happened to you, from what you described,
you have that gut feeling and go see a professional, because that's the thing. At the end of the day, you're going to end up there. You're going to see a doctor.
It's unavoidable.
Right? Because if you don't treat this, it's not going away. And do you want to see the doctor when you have a really good chance of a positive outcome, or going to see the doctor when you get really, really bad news that you can't do anything about?
Right. Maybe the stroke, which we definitely want to avoid.
It's the empowerment of, hey, this is the cards I'm dealt and here's how I'm going to play it.
Yeah,
versus just ignoring it.
Yeah.
Like everything else.
Of course. Nothing is easy. Yeah. Life lessons. Yeah. Life lessons here. Dr. Wilner, from your perspective, what are the top things that people should know about AFib?
Yeah, so I think, number one, atrial fibrillation is the most common heart rhythm that we treat. So it's very common in the community and we have very effective treatment options for it. I think number two, early treatment is key. So really early diagnosis is key, which means, that's why it's so important if you think you have atrial fibrillation or palpitations, it's so important to go to a physician to get evaluated. And number three, if you have atrial fibrillation, you really should get evaluated by an electrophysiologist, because we have some excellent treatment options available. And as Mark said, and the data supports this, early treatment is what's key to get an excellent outcome.
Wow, this has been an amazing conversation. Really, I have learned a lot, and it's been really interesting from a human perspective, from a medical perspective. So thank you both for sharing your story, sharing your knowledge with us, and continuing your wonderful work here at Baptist. Thank you. Thank you guys so much. And of course, for you and our audience, be sure to hit that subscribe button on our channel here to keep up with the latest health and wellness information and tips from our experts. Thanks for watching.
Find additional valuable health and wellness information on our resource blog at baptisthealth.net/news. And be sure to interact with us on our social media channels for live and upcoming events. Baptist Health Talk is brought to you by Baptist Health, the warmer side of care.